It's been increasingly clear as energy prices have risen and the economy has declined that swimming pools were going to be getting colder. These are tough times for leisure services. The public sector centres are particularly expected to be hard hit. 40% of council areas are at risk of losing their leisure centres and swimming pools within 5 months, according to the trade body ukactive. Now, the sport and leisure sector is benefiting from the government's energy bill relief scheme, but the sector's reported that energy costs have risen from 500 million in 2019 to more than £1 billion this year. Our sports news correspondent, Laura Scott, reports.
Are you ready? Run it forward. Run.
For 16 years, the aquarobics class on a Monday lunchtime at Rye Sports Centre has had locals queuing at the door. For half an hour, that means much more to them than simply exercise.
So we're punching through the water for me. Good. Lots of smiles within reason, I think.
There's Peter, for whom this is a precious part of the week.
Unfortunately, my wife's going into dementia. I can't get out anywhere else, and this gives me 10 minutes to myself.
Fellow pensioner Janet says this session is vital for her joints, while others in the class say it helps them stave off loneliness and boosts their mental health.
Being with everybody else and the sort of the mental side of it and your health issues, I had a back operation in November and this is what they told me to do.
But it soon sunk in this was the last class for a while, perhaps forever, as the operator of this pool, Freedom Leisure, is shutting it for the winter because it says it cannot absorb a £92,000 increase in bills. And so, as the session draws to an end, instructor Zara is concerned about what the closure could mean.
This was a vital lifeline for a lot of people, not just on the social side, but also for the physical, and a lot of them are just going to not do anything.
It's a story that will be replicated in communities around the country over the next few months, according to recent research. The trade body for gyms and leisure centres, ukactive, surveyed a significant sample of its members. Their findings, shared exclusively with the BBC, revealed that leisure services are expected to be cut in 40% of the UK's council areas in the next 5 months, and in 3/4 of council areas by the end of March 2024. Hugh Edwards, the chief executive of ukactive, said the sector is in a more perilous position than during COVID.
Large parts of the sector will not make it through to the spring of 2023. Tragically, a number of our members' facilities are closing now, and I worry that this could create a major physical and mental health crisis in the country if we don't find solutions in the coming weeks to support these facilities through the winter.
Costs are going up not just for leisure facilities, but also the people that rely on them. Recent consumer polling commissioned by ukactive found that 43% of people said the rising cost of living would have a negative impact on their ability to keep active this winter.
And roll. Nice, good lad, moving round. And again.
In Mansfield at the Switch Up boxing gym, parents are grappling with how to make savings in every area of their lives.
And again. 1, 1, 2, roll.
11-year-old Paul has ADHD and says boxing helps keep his mind concentrated. He comes twice a week at a cost of around £8. His mum Sarah said they're currently tightening their belts elsewhere so that Paul can keep coming, for now.
When winter comes, because of my disability, I'll have to have the heating on a little bit more, and then it's just going to be difficult to bring him here with how tight money and everything's shooting up, and then I'm worried about his mental health again, if he can't come.
Ash James, Director of Practice and Development at the Chartered Society of Physiotherapy, says if people cannot access affordable leisure and physical therapy services, there will be knock-on effects for the NHS.
Particularly from a health angle, what leisure centres are really, really good at is keeping people away from the most expensive parts of the system, which are hospitals and particularly acute hospitals. And the ability to exercise locally is fundamental to stop beds being clogged up in the NHS. We are absolutely seeing that link now.
4. And again, 4. Lovely, 1, 2.
That report from Laura Scott.